Hi, everyone. It's Alex Savidge from KTVU, Fox 2 News here in the San Francisco Bay Area. And we want to talk about some of the latest news surrounding the coronavirus outbreak across the country and here in California. And to do that, we'll bring in Dr. Vanila Singh, a clinical professor at Stanford School of Medicine and the former chief medical officer with the Department of Health and Human Services. Dr. Singh, always good to have you.
Great to be here. Thank you, Alex.
All right, let's start here in California, where we are really seeing quite a bit of progress being made on controlling the spread of the coronavirus here. We have figures trending in the right direction, among other things, hospitalizations down 23% over the past 2 weeks. Another key indicator, the test positivity rate is 3.1% here in California over the past 2 weeks, sort of that rolling average. Especially when you talk about the test positivity rate, what does that suggest to you about the spread of the virus in the community?
Well, so first off, this late into the game, meaning 7 or 8 months in, and us able to ramp up our diagnostic testing capabilities means that this is likely a very positive indication. It is on its surface because it seems to indicate that the viral transmission is low, but it's also important in the sense that we have been able to increase our testing capacity quite significantly where it does actually have importance, in that we have the ability for surveillance, we have the ability to follow up on tests. It is not just people who feel symptomatic and are going in to get tested. Rather, it's an indication that folks across the population are able to get testing. And that's a very good sign. Of course, we want it to also just be a lower viral transmission rate. It can also be reflective of the precautions that our population has definitely learned these last few months.
Yeah, absolutely. And of course, seeing these improving numbers, this comes after a summer where we saw, of course, a huge spike in cases. You had, of course, a lot of the holidays and people were out and about, especially here in California where the weather's nice. And we saw the big surge in cases. And now it seems like public health officials are getting some more control here. But as we, of course, have talked about in the past, you look ahead to the later months of the year. We are officially now in fall. There's been a lot of talk about the potential for the flu season to interact with the coronavirus outbreak, and you have this sort of twin-demic. How severe do you think this could be? There are some folks who look at it and say, well, we have all these, we're taking all these precautions, we're interacting less as a society because of COVID-19, so that might actually mean we have fewer flu cases. Where do you come down on this?
Yes, so I absolutely believe that our good habits right now will pay off in some manner from really letting this blow up. But on the other hand, with the good decrease in hospitalizations and positivity rate, we don't want people to let up on that. So I would say that's very important to continue what we are doing as a society, and we know how we're doing it. Secondly, because the positivity rate is lower, specifically if you think about San Diego or Orange County, they are going to start to reopen some indoor dining and movie theaters and schools and stuff. So all the more reason to stay ahead of it because we are entering flu season. And thirdly, and maybe most importantly, is really to get your flu shot. Yep. This year of all years, if there's ever been a time to really follow through for those at risk, the children, and all those folks, when you get those emails from the pediatrician or you walk into Walgreens or CVS and you see the flu shot signs, really please, if you haven't done it yet, do it, because this is really the year to do it, to avoid a crunch at the clinics, at the hospitals, right, and really and make sure that you and your immunity stays on top of things. So yeah, I would highly encourage that.
Great, yeah, certainly great advice to ease potential, overcrowding at hospitals and doctors' offices and so forth. When we look big picture here at the United States, nationwide this week, we reached a really sad and troubling milestone, 200,000 deaths from COVID-19 in this country. How did we get here? Why does the U.S. have the most deaths of any country in the world and a disproportionately high number compared to our population?
Well, look, I mean, we know that we were definitely caught off guard with the novel coronavirus, new virus coming into our society. And there's a lot to be said about the origination of it And we have to look at it to prevent such a thing from happening again. The World Health Organization, CDC, exists for that reason, so that when there's an outbreak somewhere else in the world, we can quickly be there on site and as a world, really, with our expertise, stop this. But it occurred here. We know that we are also very data driven in this nation. We do record deaths. We record deaths that could be due to other reasons when someone is positive for COVID. We also know that we were very open about our nursing homes once we understood what was going on. It was tragic. It happened in Italy, and that was definitely in many ways replicated in New York City. So we have seen that. We, like I said, we are very open about recording the number of cases, which is quite a bit, over 6 million now, and unfortunately the deaths. I must say that a lot of that has to do with transparency. It also has to do with the fact that it hit our vulnerable high density areas, which if you look at it, maybe the top 5 states, New York, New Jersey, Florida, California, and Texas really account for almost half of those deaths. And so, you know, that says a lot about the characteristics of the virus. And I think that transparency, though, does help us because we're able to identify the real problem and solve it. And what we have known about this is it's a virus that hits hard those with comorbid medical issues, and it hits hard on those who are elderly. So we really want to keep an eye on that and ensure that we limit this as much as possible.
Let's talk now about an issue we saw play out again this week, and it's an issue with mixed messaging, I guess we can call it, from the CDC. Once again, this week, the CDC backtracked on guidance that it issued. In this case, it was guidance about airborne transmission of the coronavirus. In a post that was put up on Friday, there was an acknowledgement that one mode of transmission is through the aerosolized particles we've talked about that really can linger in the air a lot longer than the droplets that come out of a person's mouth, let's say, when they're sneezing or coughing. But then the post about airborne transmission, it was taken down a few days later. The CDC says this was posted originally in error. It was a draft post. It was not meant to be put up. But this has happened before with the CDC being forced to kind of walk things back and reverse positions on certain guidance. But what does this create sort of a credibility issue for the CDC when this happens over and over?
Well, it certainly doesn't beget confidence in the public when you see one of the most respected agencies kind of have this back and forth. What I always like to say is that, you know, there are processes in the government that defy what we see certainly in the private sector. And there are drafts that need to be approved. They go through a variety of different experts at different agencies. Even if it's a CDC a statement, it had to have gone through other things, and it could have been prematurely posted, which is really a shame because a lot of people do a lot of hard work there. I certainly would emphasize that. There are people who are career professionals and people in the administration. They're all consummate professionals who want to do the right thing. The unfortunate thing with the novel virus that we are learning information from all the time means that there's going to be some disagreement, which is very scientific to have different perspectives and different views. But sometimes how things are worded can cause a misunderstanding. We know that the new testing guidelines when the CDC issued it was very confusing. We spoke about that here on the program, that they may have intended it to be a little bit more clarifying, but in fact, it probably muddled the message. Similarly, in this case, though a draft got posted erroneously, that made the greater headlines. What's more important is what they come out with in their final analyses, which still can be modified. They still can be modified.
Well, okay, so here's the question. A lot of people looked at what was originally posted, which was saying that, that airborne transmission, aerosolized particles is one mode in which the virus can be transmitted. And a lot of people look at that and say, well, what's wrong? Why remove that? Isn't that fairly common knowledge in the medical community?
Yeah, I mean, I'm not certain, and I don't want to speculate on why that was removed, but it is clear that that's not the major mode of transmission. Mm-hmm. And I'm not certain if people wanted to decrease the concerns or the fears about, air lingering and maybe calm the population. Either way, I don't think it really gave confidence. I think it has left an element of confusion, and I look forward to them clarifying it for the public so that not only do the average people who are walking around wondering if that's a possibility, but more importantly, our medical procedures where there are risks of aerosolized particles, that has definitely immediate consequences on
Sure.
procedures that are done and how our colleagues in medicine prepare for that with PPE. So I look forward to that clarification.
Yeah, and I guess the anticipation is that they will be putting up some guidance that will be ready for public consumption at some point here in the near future. So we'll wait and see exactly what the wording is when that's posted. Finally here, Dr. Singh, as we wrap up here, we always like to sort of look at where we stand with the creation of potential vaccines for the coronavirus. Obviously, we know a lot of companies are working on this. And of course, there's the talk about some of those companies vaccine manufacturers trying to speed up the process by getting an emergency use authorization for a vaccine, getting that approval through the FDA. But this week, the FDA says that it's going to be rolling out tougher standards for issuing those emergency use authorizations to vaccine manufacturers. What kind of changes are you expecting here, and how might this affect a timeline for getting a vaccine to the public?
Well, look, we've seen in the last couple of weeks a real drop in public confidence in terms of vaccinations and the upcoming potential COVID vaccine. Some of that is due to the political nature of discussion, which really needs to be removed. This is a serious time that we're in. The pandemic is serious. It has to be all about science, and it has to be objective. And so having said that, I believe the FDA came forth with this to really regain that confidence, which is going to be important, because when that vaccine is issued, particularly the emergency use authorization, it's really going to be important for those targeted populations that have a higher risk of morbidity and, worse yet, mortality, meaning the elderly, the comorbid, those on the front lines. And so it's very essential that they certainly get that first, and then of course the broader population. What I anticipate is that the bottom line is going to be that high standards for benefits overriding risks of the vaccine are going to be carried out. My understanding is that safety data, because it will be limited in the beginning, because they do a readout of how people are doing in terms of response to the vaccine, in terms of their immunity, their antibodies. If that looks promising in a significant way, there's a threshold that's already established. If that looks promising, they will then likely issue that emergency use authorization. So it's really important for the public to know that there are standards. I think this statement was really to state that whatever the lower threshold may have been for a medical therapeutic, the vaccine standards will be high and tough. And the bottom line will be efficacy and safety.
Yeah, really just the FDA trying to send the message that no corners are going to be cut here. Even though we all, of course, want a vaccine as soon as possible, you can't cut corners when it comes to the science and when it comes to the safety and effectiveness of a vaccine. Dr. Vanila Singh, always good to have you on to break these things down for us. We really appreciate your time and of course, your insight. Dr. Singh is a clinical professor at the Stanford School of Medicine right here in the beautiful Bay Area, and a former chief medical officer with Health and Human Services. Thanks again. Look forward to chatting with you next week. Appreciate your time.
Thank you, Alex. Always a pleasure.
All right. I'm Alex Savidge from KTVU, Fox 2 News here in the San Francisco Bay Area. I will talk to you next time.